Welcome everyone, good afternoon. Thank you for joining us today for the webinar Informing Food Policies Through Web-Based Epidemiological Studies, Insights from the International Food Policy Study and NutriNet Brasil cohort study. I'm sure we will have a great discussion with these two great speakers that we will have today, and I'll introduce them soon. But let me start by introducing myself. My name is Camila Gabi. I'm a PhD student of the University of São Paulo in Brazil, and I'm currently in Canada for a research internship at the University of Waterloo. I'm organizing these events as part of my internship with the purpose of promoting exchange knowledge between Canada and Brazil, which is one of the objectives of my funding agency in Brazil, the São Paulo Research Foundation, or FAPESP. And it's also one of the objectives for them to promote internationalization of their students. Well, the rationale for our event today is that online surveys are becoming increasingly popular in epidemiology studies, given their convenience for participants and as well for the researchers. Also because of their cost effectiveness, potential reach, and the possibility of real-time data collection. And due to these advantages, they can be an important tool for informing public policies. However, there's also some potential challenges of these studies compared to traditional methods of collecting data, such as sampling bias and non-response bias, technical issues, and also restrict access in certain populations. So in this webinar, we will discuss some experience from two large-scale web-based epidemiological studies with two different designs. One is cross-sectional and the other one is a cohort study. The first one is the International Food Policy Study, or IFPS, which is an annual cross-sectional survey conducted in 6 countries: Australia, Canada, UK, US, Chile, and Mexico. The IFPS is coordinated by the Professor David Hammond, who is with us today, and also for his team at the University of Waterloo. But it counts with a big network of researchers in all these countries that I mentioned, and also from several institutions. The second study that we will discuss today is the NutriNet Brasil cohort study, which is a longitudinal study conducted with a large sample of Brazilians. So there's more than 1,100 Brazilians in this study. NutriNet is coordinated by the Professor Carlos Monteiro at the University of São Paulo, and it also counts with a big group of researchers and students, including myself. And the NutriNet has also other partners, other institutions partners in Brazil. So let me cut to the chase and introduce our first speaker today, Professor David Hammond. He is a professor and university research chair in the School of Public Health at the University of Waterloo, and he's also my supervisor in my internship. His research focuses upon food and nutrition policy, including the areas of nutrition labeling, food marketing, and public education. Professor Hammond works closely with governments around the world and has served as advisor for the World Health Organization. And he also serves as an expert witness in court cases, primarily on behalf of governments defending regulations from legal challenges by the tobacco, food, and cannabis industries. So David will talk about the International Food Policy Study. And Dave, the floor is yours. You can share your screen and start your presentation.
Great, thank you. Can I just confirm that you can hear me and see my screen, Camilla?
Yes, it's not in presentation mode yet.
Great.
Okay.
There we go. Look, I just want to start by saying thank you for the chance to speak today. It's been absolutely wonderful to have Camilla visit us. I've spent time in Brazil. I've worked with your Ministry of Health on tobacco control policies and meetings in Brasilia, and so it's been just wonderful to have this kind of a connection, and I hope it continues in the future. I'm afraid my Portuguese is non-existent, so I'm going to have to speak in English today, but I appreciate your patience with me. So as Camilla said, I'm going to describe a study that we call the International Food Policy Study, or IFPS. And I'm just going to describe what it is, why we do it, and I'll share some findings. And I'm more than happy to answer any questions specifically about methodology for online surveying, et cetera. So in terms of why we do this study, we are seeing more countries implement national level food policies. So, countries like Chile and Mexico are among the global leaders, and we're seeing more policies implemented in more countries. And we'd like to know whether these are having an effect or if they're ineffective. And a lot of us, including my lab, try and do experimental studies. We show people different nutrition labels. We show them different types of ads or marketing, and we try and estimate or guess how these policies would work. But in many cases, you just can't replicate. You can't test the same effect of a real policy when it's implemented in a country, in a laboratory, or in an experiment. So we have lots of these experimental studies, but we need more real-world post or after implementation studies. And I think Brazil, as I understand it, is one of the leaders. Canada has many people working in the field of diet and nutrition policies, but we don't have a very good national monitoring. So in Canada, we've had our main government dietary recall surveys happen once every 10 years. That's not enough. That's not enough to understand how things are changing. And it's not enough to understand how policies are changing, because there are lots of other changes, as we all know, in the types of food and the retail market, things that we think of as secular, things that aren't related to policy, but the market, the food environment is constantly changing. And of course, we have changes like the global pandemic that had a big impact on, how people access their food and cooking and what types of food they consume. And in North America, at least, we've experienced major price inflation. So the food prices have gone way up. We've had challenges and questions about food insecurity. And so this makes it very difficult to try and understand policies and separate it from all of this change that's happening. And so what we're trying to do with our study is capture what we call natural experiments. We can't randomize countries to have certain policies. But what we do is we can, if we do surveys every year in different countries and use the same measures and the same methods, it gives us comparisons within each country over time and then between countries over time. And this sort of builds in the pre versus post policy implementation design. This is our quasi-experimental or natural experiment design. Because if one country brings in a policy, we have measures before and after in that country and in comparison countries. So a good example, a good way of thinking about this is with front of package nutrition labeling. Now, I know that Brazil will be implementing a version that looks like the image on the right, and I'll talk about that more in a bit. But in the countries that participate in our study, and I'll talk more about this, but in our study, we have the United States, Canada, the United Kingdom, Australia, and Mexico. If we look at those countries, they have each, they have implemented different front of pack nutrition labels. So in the United Kingdom, they have traffic lights, like you see on the screen, and those are voluntary. In Australia, they have something called the health stars. Those are also voluntary. And then in Mexico, they have a mandatory regulation, and it used to be something that looks like the industry's information, what we call the guideline daily amounts, or GDA. But in 2020, Mexico implemented sort of warning symbols like they have in Chile. And so here we have different policies in different countries. And then we have one of our countries changing their policy. And because we have annual surveys, we can see how these things change over time. And you might know that Canada will be implementing a mandatory front of pack nutrition label that looks very, very close to the one in Brazil. And as you might know, the look, the design of that label was actually something that the food companies lobbied for very hard in both Canada and as I understand it, Brazil. So it looks different than what they have in Chile and Mexico, but at least it is mandatory. And so how do we evaluate policies? Well, this is what we call our conceptual map. And so we have a policy like nutrition labeling. That's in the green box. And what we try and do is we say, well, if a country brings in labels, the first thing it will affect is, do people see the label? Do they understand it? Do they use it? Does that change their food knowledge, like which foods are healthy or not? And if those things occur, then maybe that affects their diet-related behaviors in terms of the choices of food they eat, switching types of food, maybe diet modification efforts. And that in the bottom, you can see individual factors. So whether a policy works could be moderated or mediated by things like age or sex or family or socioeconomic status. And so this is sort of the conceptual map. And what we try and measure in our study are the things in that red box. We call those sort of proximal because they're closer to the policy. They're the first things to change. And the point is that we can't just look at the overall end outcome of diet quality or nutrient intake because there are so many different factors. Things companies are doing, consumer trends, other policies, things like the pandemic. So the idea is we measure the sort of the upstream or more proximal outcomes, and that gives us a better idea of whether they're affecting the downstream dietary intake outcomes. And you know, some of those upstream outcomes, like do people see them? Do they understand them? Do they use the nutrition information? Those are actually the types of outcomes that our laws and regulations refer to. So in Canada, when they make the regulation, they didn't say, we're definitely going to reduce obesity and reduce chronic disease. That's the overall goal, but the specific objectives are some of those things like knowledge and use and understanding. So a little bit more in the method. So what is this? Well, we have our adult surveys. And as Camilla said, these are repeat cross-sectional surveys. We do them in 5 countries. And we started in 2018. And we have enough funds to do, it should say 7 funded waves all the way up to and including 2025. And these are adults 18 years and older. And we have about 20,000 per year. And in some of the countries, we do dietary recalls. So I'll show you what that looks like. So in each country, in each year, we have about 4,000 to 5,000 people. So with the 5 countries, that's about 20,000 or more every year. And then we do it year after year. So you can see that we've done it with a total of about 118,000 people. And every year we'll have another 25,000 people. So that's what our sample sizes look like. And our surveys ask about all sorts of dietary patterns and intake. We have certain types of policy domains like where people source their food. Do they use nutrition labels? What campaigns have they seen? Food price and taxation, which policies they support. And then important things like you know, socioeconomic status, cooking skills, weight loss efforts, all sorts of things. And by the way, all of our surveys and methods are available online in case you're interested, and I'll share that link at the end. Now, in 4 of our 5 countries, we also do 24-hour dietary recalls. We do one single dietary recall. We don't do this in Mexico because they don't have an online 24-hour dietary recall that's been validated. But we do it in Canada, Australia, the US, and the UK. What we get is after people finish our survey, we send them to the 24-hour recall sites. And we get about 65 to 75% of people who do our survey go on to complete the 24-hour recall. So that means we have about 2,600 to 3,000 dietary recalls each year in each of these 4 countries. And in Canada, US, and Australia, we use the ASA 24 dietary recall. That's the one from the National Institutes of Health. And in the UK, we use the Intake 24. Now, we also have a set of youth surveys. And these surveys are done with 10 to 17-year-olds. We do them in the same countries, plus the addition of Chile. We have youth surveys that happen in Chile. And we started the youth surveys in 2019. And we have slightly smaller sample sizes of about 1,500 per year per country. We have some extra in Canada just because we have extra funding for that in Canada. So we have 10 to 17-year-olds in our youth surveys and then 18 plus in our adult surveys. Now we have lots of information on the technical reports. Just very briefly, some of the methodological challenges that Camilla mentioned, and I'm happy to answer questions. So we recruit our respondents from commercial panels. We use Nielsen. And so for the most part, they're non-probability samples. And what we do is they send their panelists to our site. We program our own surveys, so we have full control over the data quality and screening. We use post-stratification survey weights. We have several layers of data integrity questions. And one of the things we spend a lot of time on before and after we apply our post-stratification weights is comparisons to our best national surveys in each country. So we certainly do that with the sociodemographic factors, but we also do it where we can for things like, is the prevalence of obesity in our sample the same as our best national survey? And there's often some other food and diet related outcomes that we can compare. And usually we do quite well. Our sample is typically slightly higher in terms of lower perceived health, lower education. But generally speaking, our estimates are quite close to those other surveys. Now, what I want to do with the last sort of 5 or 6 minutes is just share with you some of the findings to give you a sense of how we use the study and the data. And so I'm just going to share some of the findings on food insecurity. Now, we have these measures for adults and youth, but I'm just going to show you some of the work we've done on youth. And we've published this data, and I can share the papers with anyone who's interested. We've been working with a researcher, Ed Frangillo, from the United States, who has validated a measure of food insecurity that children can answer. And he's published this with data in a number of different countries. And I just wanted to give you a sense of what the data look like. So when we administer this survey in our youth surveys with 10 to 17-year-olds, this is how it looks in Canada. And this is how it looks in terms of the changes before COVID in 2019 to after COVID. And really the most important category is that red one. Those are the youth that say they have many food insecurity experiences. So those would be the most at-risk group. And you can see that it didn't change much in the first year of the COVID-19 pandemic. Canada had very strong extra social and income supports that actually ended often in 2021. And so, one idea here is that those social supports were protective, and when they were removed, then that's when we saw an increase in child food insecurity in Canada. And I'll share these slides. This is far too much data for you to absorb. But what you can see across the different countries is sort of a similar phenomenon, which is higher levels of food insecurity in some countries than others. And you generally see sort of some increases between 2019 and 2021. Although that really varies depending on whether it's in the red, orange, or yellow category. So I'll share these with folks, but it gives you some sense of what we're measuring. And what we can do is we can look at how this measure of food insecurity aligns with things like income adequacy. So there's a question that we ask about whether people's family have enough money to make their ends meet. I actually really like the question. It's much better than household income, which is hard for many people to report. And this is just showing you that same data of food insecurity, but I'm showing it to you in 4 groups based on income adequacy. And this is what we'd expect. The kids on the far left who say they don't have enough money, their family doesn't have enough money, you can see much higher levels of food insecurity. And then as you move to the right, those are kids that say that their families have more than enough money. And you can see that the biggest difference pre and post pandemic is in that group in the red box that say that their families had barely enough money. And that's probably because those families may not have received the same number or amount of social support during the pandemic, but they were sensitive to the increase in food prices and the pandemic effects. So we can start to tease apart if there are changes in food insecurity, what type of households were they most likely to affect? And, we can look at, in Canada, we call them food banks, where they give food to people in need. And we can look and see how our data compares with data on the use of these services in the communities. Second thing I'll just point out to you is around school food environments. And one of the things that we're interested in, again, staying with this theme of food insecurity, is there are different policies about whether countries offer school food programs. And so we know what those policies are, but we ask the kids themselves, hey, in your school, does your school have a free breakfast program? Do they have a free lunch program? And what you can see here is that it's actually Chile and the USA, United States. They are the two countries that have national policies. And you can see that their children in those two countries are much more likely to say that their school has programs. The UK does have a national policy, but it's a little bit less comprehensive than Chile and the USA. And you can see that wealthy countries like Australia and Canada, very few schools are offering free food to students. I'm going to skip past this, but this next slide shows you the effect of the pandemic. So in many of these countries, there were schools shut down, kids were at home. Even when kids went to school, the services in the schools had to shut down. And you can see in the pandemic, in the worst phase in 2020, you can see that many fewer kids are getting food from the free breakfast or lunch program at their school. And this was a big issue in some countries where it was an important source of nutrition for low-income families that disappeared during the pandemic. And then you can see it rebound again in 2021. And the biggest differences were in Chile and Mexico, where the most kids were receiving those programs. And what's interesting is that when we look at countries like Canada that don't have a national program, and then you say, okay, let's look at the kids who do say that they get some breakfast or lunch from school. What you can see is that actually in terms of across income groups, places like Canada without national policies are not doing any better for the kids in greatest need, whose families do not have enough money, compared to the wealthier kids. So first of all, not many kids are getting it. And very few of the kids that are in greatest need are actually being able to get food in schools. And I would say as a Canadian that this is a national embarrassment. We are a very rich country, and yet we are not able to provide kids in need with the food through school programs in the same way as other countries. Now, we ask more detailed questions. We ask, if you do get food from school, what kind of food do you get? And this, again, is far too busy for you to understand. But what you see is that some school food programs have nutrition standards, others don't. And so in Canada, for example, you can see that lots of kids are getting things like sugary drinks and fast food in schools that they shouldn't be getting. So you can start to get a picture of what's happening in schools. Now, I'm conscious of time here. I'm going to jump ahead. I know that there's a lot of interest in the food guide, but I'm just going to quickly show you a little something about nutritional labeling, because I started off by talking about that. And one of the things I told you is that Mexico brought in a new front of pack nutrition label. And there's an image of those little black stop signs and what they look like in Mexico. And part of the campaign when they were promoting this policy was that this might not just be helpful for adults, but it might be helpful for kids too. Now, I have done what I shouldn't do, and I'm showing you far too much information that's hard for you to understand. But we ask in our surveys, we ask kids, hey, do you use nutrition information that is on packages? And most countries have information on the back. That's what we call the nutrition facts, and it has all the numbers. And what I'm showing you here is when we show it to kids, and we say, hey, do you use this? Have you seen this type of food information? You can see that lots of kids say they've seen those numbers on the back, and it's pretty similar across the different years in each country. For those countries that have front of package labels, we also ask, hey, have you seen this type of label? And in Australia, that's the health stars. In UK, it's traffic lights. And you can see in those two countries where front of package nutrition labels are voluntary, so companies can do it, but they don't have to. You can see it's really not any higher than what's on the back. But there's Mexico. And you can see that when Mexico implemented and switched to the black stop sign, you can see how many more children and youth said that they've seen those images. And when you look at Chile, you can see that almost every child and youth in Chile says, oh yeah, I've seen those labels. Now we ask if they've seen them. We also ask if they use these labels when deciding what type of food to buy. And you can see it's about 10 to 20% of kids in each country that say they use the numbers on the back of packages. Well, what about the front of packages? It's about the same in Australia. Remember, those aren't on every food product. It's only the ones the companies want. It's about the same in England, same voluntary. But what you see in Mexico is a big increase after they brought in the new labels, and it looks a lot like Chile. Now, 10%, you know, the difference between 20 and 30% may not seem like a lot, but it certainly is at the population level, where in Brazil, for example, you'd be talking about millions and millions of children. And where we see the biggest difference is whether people can understand the information. So we know that people in general and kids, not many people understand the numbers that we give them. And this is where you see the biggest benefit for front of pack nutrition labels. Even in the US, in Australia and UK, you can see that more kids say they understand the information on the front. And this is where the simple warnings in Mexico and Chile do especially well. So they're just far easier to understand. They basically say this food has some unhealthy level of nutrient, and kids can understand it far more easily. So I'm showing this to try and illustrate the changes within country over time, as well as the differences between countries and how we use that when a country like Mexico brings in a new policy. So we have sort of controls and comparisons. Now, I was going to show you a bit on the food guide. Unfortunately, I don't have time to do that. But I'll share these slides, which includes a list of some recent publications. Some of the policies we'll be thinking about evaluating in the next year are in the UK. They're bringing in some restrictions on unhealthy marketing to kids. We have some sugary beverage taxes that are being implemented in some Canadian provinces. And eventually, we'll have the front of pack nutrition labels that will be mandated, required in Canada. And there's some other policies like in the UK, they require calories to be printed on restaurant menus and menu boards, things like McDonald's and chains like that. So this is the website for our study, foodpolicystudy.com. It has all of our surveys, all of our technical reports, many of the publications. You're welcome to browse through that. So thank you very much. Obrigado. I'd be happy to answer any questions if I've left any time for that.
Thank you so much, Dave. It was a great presentation. I've been working with IFPS data for 1 year, and I'm always impressed. Every time I heard about the IFPS, I'm more impressed about the lots of data that we have and the potentialities of using this data to studies and to monitor food policies. So that's great, and I'm sure we have time for discussion later after the Eurydice presentation. So we have the opportunity to discuss what you couldn't bring during your time. So Eurydice, we're going to talk about the NutriNet Brasil study. Eurydice Martins is a postdoctoral fellow at the Center for Epidemiological Research in Nutrition and Health of the School of Public Health, the University of São Paulo in Brazil. Her research focuses on the association between ultra-processed food consumption, diet quality, and health outcomes using data-driven epidemiological methods. And she has conducted research on the consumption of ultra-processed food and its association with socio-demographic factors, diet quality, health outcomes such as metabolic syndrome and obesity among children, adolescents, and adults in the United States and other countries such as Brazil, Spain, UK, and Australia. So Eurydice, the floor is yours. You can share your screen and start your presentation.
Yeah, thank you very much for inviting me to participate in this webinar. I'm going to talk to you today about NutriNet Brasil web cohort study and its potential to guide public policies. This study was developed by the Núcleo de Pesquisas Epidemiológicas e Nutrição e Saúde at the School of Public Health, University of São Paulo. And this study is one of the largest prospective cohort studies on food and health in Brazil. Its objective is to investigate the relationship between dietary patterns and the risk of developing chronic non-communicable diseases. This study started in January 2020, and its goal is to follow up 200,000 Brazilian adults from all regions of the country for at least 10 years. This is a web-based study in which participants respond to short and quick questionnaires about food intake, health status, lifestyle every 3 to 6 months at the study website. This study is very important because, as you know, the relationship between diet and health outcomes is complex. First, measuring dietary intake can be a challenge mainly because of information bias. And assessing the association between diet and health outcomes many times requires follow-up studies to overcome limitations such as reverse causality that tend to dilute the studied associations, and many times require big sample sizes, both because the associations between diet and health many times are not that strong, requiring big sample sizes to have power to detect associations, and to adjust for multiple variables that act as confounders between diet and outcomes. There are several studies like this one being carried out in countries such as France, US, and Spain. But these results, the results obtained in a certain country, are not always applicable elsewhere. So this study will allow to study the distribution of eating patterns across socio-demographic strata and its impact on health in Brazil. This study will allow to test hypotheses about the association between diet and health, will allow to monitor diet, health, and its association over time. All these studies will generate scientific evidence that will help develop guidelines, programs, and policies to improve the diet and health of Brazilians, and can also be used to develop and validate instruments and tools to measure adherence, for example, to adherence to dietary guidelines for healthy eating. How do participants participate in this study? So any citizen who lives in Brazil and is at least 18 years old and has access to internet can participate. Participation is voluntary and just requires a registration at the website. After the participant registrates, he or she receives an email to confirm the registration, and after this, he or she can start completing the questionnaires. Important to note that most communication is carried out through email and by text messages. So several questionnaires are used in this study. The main exposure is going to be dietary intake, and to measure this exposure, two different instruments have been devised by newcomers and have been validated to measure assess diet quality. These instruments are applied every 3 to 6 months from baseline onwards. The first instrument is a simplified food questionnaire, and the second one is a detailed food questionnaire. The simplified food questionnaire is an instrument that uses yes/no questions to inquire about the consumption of a closed list of food items during the previous day. This was validated to measure 2 dimensions of the diet. On the one hand, the health protective unprocessed or minimum processed food dimension. On the other one, the ultra-processed food component. The completion time of this simplified questionnaire is 2 minutes. Then we have a more detailed food questionnaire, which is a 24-hour recall, which collects detailed food consumption during the 24-hour period, the previous 24-hour period, and it includes key yes/no questions about foods and drinks consumed on the previous day, which prompt additional questions regarding type and quantity. The completion time, estimated completion time, is about 15 minutes. After the participants complete each detailed food questionnaire, they receive by email a report that includes the caloric share of the main food groups. This is important to help professionals monitor the participants' diet and also helps participants engage and remain in the study. A second set of important questionnaires are those related to lifestyle. So these collect information on health determinants not related to diet, such as lifestyle determinants, which can confound the association between diet and health outcomes. These sort of questionnaires are applied from baseline onwards every 3 to 6 months and include questions on physical activity, sedentary behavior, smoking, alcohol consumption, sleep, among others. The third set of questionnaires are applied to collect data on new cases of chronic diseases identified through medical diagnosis and or validated symptom scales. Some of these outcomes are hypertension, diabetes, dyslipidemias, heart disease, chronic respiratory disease, several types of cancer, stroke, chronic kidney failure, migraine, gastrointestinal, and depression. There are many others, but these are just a couple of examples. So questions about these outcomes are applied every 6 months from month 14 onwards. And after month 20, this is important, participants are requested to send reports of exams or prescriptions to confirm this diagnosis. This is important, for example, to carry out a sensitivity analysis, for example, using confirmed outcome measures, rather than just those reported by the participants. And something interesting as well is that this study has the flexibility and allows to include questions on new diseases. Should this be interesting? Participants can request a certificate of participation at any time. And this again is important to engage and retain participants in the study. Regarding the study profile of participants, first of all, up to this date, more than 100,000 participants have been registered, 82% of which are active. Over 75% of them are women. Over 60% are from the southeast region of Brazil. Almost 50% are between 35 and 54 years old. And over 60% have a university degree. Three papers have been published up until this date with data from NutriNet Brasil. This one that evaluated changes in diet during the COVID-19 pandemic. This other one, which assessed body weight changes during the pandemic. And this third one, that was a validation study of a scale to measure adherence to the Brazilian dietary guidelines. Something very important is that the strategies to recruit participants, because I think this is a challenge. The objective is to include 200,000 Brazilians and keep them in the study. For this, different means of publicizing NutriNet Brasil have been used. For example, television, public transportation, and social media. In addition to this, specific campaigns have been used to recruit, publicize NutriNet and recruit participants, both in social media and in basic units of health. There are several partner institutions behind this study, and there are 3 funders of the study, which are Humani, FAPESP, and Senepec. So what is the potential of NutriNet Brasil to guide public policies? Well, in fact, any well-conducted epidemiological public health study can guide public policies. I think the big advantage of these longitudinal web design, big sample size studies, is their potential to reach many people in a short period of time and to follow them up. which allows running new studies for testing hypotheses with low resources and in a timely manner. And I think for guiding public policies, providing results in a timely manner is key. The fact that these sort of web-based studies, as many cohort studies in fact, tend to have biased samples, I think can be at least partly overcome through the way to obtain national representative results. This study carried out in NutriNet France, which has been in field for over 10 years and is similar to the one in Brazil, conducted a study which showed that the main motives for participating in NutriNet France, among the main motives was the use of internet. And the motives differed by sociodemographic profile. For example, people that were older, non-obese, or employees, manual workers, were less motivated by the internet aspect. I think this is important to confirm that carrying out web-based studies may be an advantage, for example, in terms of increasing recruitment and retention rates. Because the NutriNet Brasil study has been in field for a short period, I have chosen some studies that have been carried out in France, NutriNet France, to showcase the sort of studies that can be carried out to inform public policies. For example, we have this study that evaluated the acceptability and understanding of different formats of front-of-pack labels in use worldwide in 2015. There's the guideline daily amounts, the 5-color nutrition label, the multi-traffic lights, and the green tick. And this study was useful to show that the 5-color nutrition label performed the best when comparing to the product's nutritional quality. An additional study carried out by NutriNet France, carried out 2 years after, investigated the perception of 4 formats for a front-of-pack nutrition label, which were at that time being considered in France as potential front-of-pack nutrition labels. And their conclusion was that Nutri-Score had the widest reach, especially among participants with lower adherence to nutritional recommendation. This third study, also carried out in NutriNet France, observed that a higher adherence to the updated 2017 French dietary guidelines was associated with a lower weight gain and lower risk of developing overweight obesity. And they also showed that adherence to the previous French guidelines were less strongly associated with these outcomes. So this study was useful to confirm that the French dietary guidelines are effective in reducing the risk of weight gain and probably subsequent chronic diseases. Last of all, this fourth study observed that a higher adherence to the updated 2017 French dietary guidelines was inversely associated with a number of cardiovascular risk factors, prevalence of metabolic syndrome, and regional adiposity. And this helped them conclude that the French dietary guidelines are likely effective in preventing cardiometabolic abnormalities and thus probably cardiovascular disease. Last of all, a study I previously mentioned, one of the 3 studies that were published with data from NutriNet Brasil, validated a scale to measure adherence to eating practices recommended by the Brazilian dietary guidelines against healthy eating consumption assessed through dietary questionnaires. And this scale that has now been validated in NutriNet Brasil can be used in future studies to measure adherence and successful implementation of guidelines for healthy eating and changes over time. Yes, thank you.
Thank you so much, Teresa, for your great presentation, for bringing information about the NutriNet Brasil study that we have been working together in. So let's start our discussion. We have some questions in the chat. And I would like to ask people to, for those who are in the room, can ask in the microphone if they feel comfortable, or send in the chat on YouTube. So we have a first question for David. what are the strategies employed to recruit participants for the international food policy study, and which ones proved to be more effective? Sorry if you have already mentioned it. So I think this is the question you can comment.
Yeah, sure. Great question. Now, I'll just say I run lots of different surveys, and I have used virtually every methodology you can imagine, from in-person, exit surveys, mail-based surveys, random digital phone surveys. We currently use commercial panels. So like there are big companies like Nielsen that have panelists, survey respondents, and we draw from Nielsen's panels. Now, the downside is that these are not all probability-based recruited. And so there are going to be biases. And so we try and manage those by setting quotas in certain countries. We do that through the post-stratification weighting process. And then, as I mentioned, we spend a lot of time comparing to national benchmarks to see where we're different. Now, we know there are some biases, but what's important is the same biases over time. So that if we do see changes, so we might have a slightly higher prevalence of obesity, but if we see changes over time, and we see those in the countries that implement a policy, and that's more than other countries, then we can still be confident of what we're seeing in terms of a policy. There are other methods. If we had more money, I would prefer to recruit our own probability-based sample, but it is very expensive to do that. And one advantage of Nielsen is they do have common methods across the countries, and it is fairly inexpensive. So in United States dollars, $8 to $10 per respondent. But if you're doing 30,000 respondents a year, you can see how it becomes quite expensive. So I think hopefully that answers the question.
Yes, thank you, Dave. While people register more questions here in the chat, I would like to add a question on this and also ask to Eurydice, because one difference between Canada and other countries compared to Brazil is that in Brazil it's not allowed to, for ethical reasons, not allowed to pay for participants to keep them in research. So this is a big difference, and with implications in the quality of data that they have. And Eurydice commented that we have, for the NutriNet Brasil, there's like a report about dietary intake for those that fill up the 24-hour recall, so as a compensation for the participant. But I would like you to comment, Eurydice, how do you see this, the challenge of keeping the participants in this study, considering that we cannot pay for them to participate?
Yeah, in that slide that showed the participant profiles, we see that over 80% of participants that registered actually remained in the study, which I think is a good it's a good sign. I think from the start, people that are the participants tend to be highly motivated from the start. So I think it's likely that they will remain in the study, even though they're not paid, to participate, for example.
Like, yeah, 80% rate of retaining is for sure great, and that's interesting.
Yeah, as David was, what he was saying, that I guess the important thing is it is a biased sample. It's not representative of Brazil, but if the bias remains over time, I guess conclusions may be more valid, right? I think
that's a great point. And there's a lot of misunderstanding about surveys and terms like nationally representative and what that means. There are almost no surveys in most countries except for like a census or the best government surveys that cost millions and millions of dollars. And so some people say, well, you either have the best or you have everything else, but there is lots in between in terms of data quality, in terms of understanding biases, and then understanding the limitations of those biases. Sometimes it's a big problem, sometimes it's not too much of a problem, and you can manage some bias. It's very difficult to survey nationally. In Canada, we are allowed to pay. And the best survey that we have done, like Brazil, we have some very remote parts of Canada. It's up in the northern part of Canada, where we have very high levels of Indigenous peoples. When we survey up there, we actually send a postcard to every household, all 50,000, and then we ask them to join us online. But we pay them $20 for every survey. And that is a key part of us being able to recruit. But anyway, you make a very important point that there are many different levels and types of surveys, and some methods are appropriate for answering some questions, but even the biggest national surveys often give you slightly different answers based on methods and things like that. So it's a challenging area, but it's one that I think we need to talk about more so people understand.
Thank you, Dave and Euridice. We have another questions in the chat on YouTube. And it's something that I was wondering about while Dave was presenting as well, because you presented the comparison of the front of package labeling on Mexico and Chile, and the results are really great. And I was wondering about what will be the difference comparing to another types of symbols. So the question in the chat is, amazing methodologies and results. Thanks for sharing it. But I would like to know more about how the magnifying glass model was developed in Canada, especially about the lobby. And there was another two comments from the same participant. Because in Brazil, the Canadian magnifying glass was considered by the regulatory agency as a safe option and evidence-based model with a lot of industrial lobby. Is your research group studying the effectiveness of the magnifying glass in Brazil as a natural experiment for the Canadian model? And if positive, what do you expect as effectiveness results? Yeah.
So we have done experimental studies on the magnifying glass. What happened was Canada had said they would bring in a front of pack label. And then the question was, what should it look like? And the magnifying glass was something that our big national food companies said, oh, we've developed this thing and we did some testing and here it is. Well, there was a year or two between when they suggested that and when the government made their decision. And we did several studies. And all the studies we did showed that it was about the worst one you could pick. A magnifying glass doesn't tell anybody anything. It just uses the space. It's supposed to say, look closely, but it's not a symbol that people use. It was the least effective. But there was so much industry lobbying around front of pack labeling. Our national health minister visited our university, and she said that there was no other topic that had as much industry opposition and lobbying during her time in government. Very strong. And there was questions about whether they would have any policy. So I think it was the government, in English it's compromise. They wanted to get something done and they saw this as a compromise. But you know the industry, how they work. They say, well, Canada's doing it. Canada likes this one. And in Canada, they'll say, well, they're going to do this in Brazil. So is it the most effective symbol? No. Now, having said that, the principle is still there, that you have something on the front that is visual, that will sign to consumers that this has high levels of negative nutrients. And so but we won't be able to truly evaluate it until it's implemented, and there's still 3 more years before it comes out. Now, I'd love to do some surveys in Brazil or share measures and see. Does anybody know when is it being implemented in Brazil? Is it on packages now, or
Yes, the new products that are being manufactured now it's already mandatory, but the products that are already in market, they have some extra time to adapt it.
So
but
it's
there's
happening
already
now.
product. Yeah, it's happening.
Well, there's some really interesting comparisons between Chile and Brazil, obviously being neighboring countries. But what I just showed you some of our data from youth, but we have them for adults too. And it's amazing because you see, like, Mexico and Chile are very different countries, but the same warning and the results are almost identical in terms of the amount that they change. So it'll be very interesting to have a comparison with Brazil. We haven't done that. I'll be very interested if others do that.
Yes, for sure. Thank you, David. We have a question in the room.
Hi, good afternoon. Can you hear me well? So we have a couple of questions. I will put them all together and you can answer as you want to, okay? The first one is about the nutritional label. We want to know if you guys investigate how marketing of food labels could interfere in the understanding of warning labels. Because, in Chile and in Mexico, they have some kind of policies and they do not are allowed to put some kind of marketing in the labels when they have the warnings. And we also want to know how front of package labels can support other policies, and each one you believe are more important. We also have a question about sweeteners, because this week the World Health Organization published about the use of sweeteners and how bad they can be. And we want to know if in Canada you discussed about taxation of foods that has sweeteners. And I think Thais has another question too.
Yes. Yes. Good afternoon. My name is Thais. I'm a PhD student here in School of Public Health. And I'm very impressed about your data. And I would like to hear you about your hypothesis for increase the insecurity food in children. Thank you.
Thank you. Those are all great questions. I sure wish I could reply in Portuguese, but I can't. The first question about marketing and how it might interact with the front of pack nutrition label. We actually did an experimental study. We call them promotional claims. That's where the company will say less sugar, and we actually did one experiment where people saw the warnings without claims, or they saw them in one part of the package, or they saw them right next to it, and you do see effects. And so Canada does have a part of the regulation says that you can't make promotional claims. So even if it says high sodium, you can't say something somewhere else about, low sugar or something like that. Now, there are many other ways that the companies can try and redesign their packages. And that will be very interesting to see. So cigarette companies did this. Brazil has very big health warnings on cigarettes, and some companies change the color around the label and things like that. So is it possible that they can reduce the effectiveness of the label? I think so, but that's why part of the rules are very important. If it has to always be in the same place and there has to be a border, and we say contrasting colors like black and white, so you can't kind of make it disappear with the background. Those are all very important for any label or warning. And if those are there, hopefully it will make any interference with marketing sort of smaller. But I can share that paper if people want. Second question, how can the labels help support other policies? I've done a lot of work in labeling. And why it's important is because it's on the products themselves. It's in the stores, it's in your house when you have the package. And I think it helps people to think about certain categories of foods. So things like, certain juices, certain like yogurt is very popular, certain like snack bars, things that people think are healthy that are not healthy. So I think it changes the way people think about certain categories when they constantly see, oh, that one, they all have these warnings. And one of the interesting things is that I think the more people experience some of these policies, they become more knowledgeable. And actually, support tends to grow for other policies. It's not like you're using up. Do you know what I'm saying? You only have so much. And if you do this policy, people are less likely to support a different. It goes the other way. And that's true for tobacco. Each policy that came in built support for the next policy. So for example, nutrition labeling might build support for taxation of certain high sugar products or whatever it might be. So we have a little bit of evidence on that, but I think we'll get more as time goes. But we do ask policy support questions. So after Mexico brings that in, we'll see how that changes support for labels, but also some of the other things like marketing and taxes. Third question was about sweeteners. I saw that WHO report. It's a fascinating area. We've done a bit of work where we ask about different types of sweeteners, and people have different ideas. So do you have aspartame? Do you know aspartame? It has a very bad reputation. If you ask about aspartame, people say, oh no, sweeteners are not good. If you ask about stevia or something else, they say, that might be okay. So it's very interesting that the idea of it being a natural sweetener is one area that changes how people think about it. But one of my PhD students is about to do a project where we are going to go to different countries, the same ones that we survey, and try and get information on every single prepackaged beverage. So like several thousand beverages in Canada, several thousand beverages in Mexico and Chile. We do this through web scraping and getting the information from stores. And we're going to look at sugar levels. And part of the idea is to see if front of pack labeling or taxation on sugary drinks like they have in the UK and Mexico, how has that changed reformulation? How are the manufacturers changing the sugar levels? We have some idea, but not many countries compare. Like Coke in one country may have different levels of sugar of Coke in another. But part of that is we're also going to be looking at the use of sweeteners. Again, we have some idea of it, but I don't know of too many studies that are really looking at how the beverage market is changing. One of the things we see in Canada is it used to be full sugar or no sugar, only sweeteners, but now they're mixing them. So you have natural sugar, and then they'll have, but less, and then they'll add some sweeteners. It's very interesting. We had a green Coke, what was it called? Coke something, but it was in a green can. Now, I don't know if you see that in Brazil, but I think we're going to be seeing more of that, which is it's not just like two different products, it's the mixing of the two. So I'm just saying that I agree that that's a really important issue. I think consumers have different ideas depending on things, but we need to know more about just how many products are using it, how are they using it, where do they label it? You might know in Mexico, you have to have there's a label for sweeteners. So anyway, and I'm taking too much time. Food security, look, it's something that we need to keep measuring. I think I'm interested in how certain policies like school nutrition policies help to protect kids against food insecurity. The major increases in food prices, how are people changing? Are they getting rid of the unhealthy foods, getting rid of the healthy foods? In Canada, meat is expensive, dairy is expensive. So it's about understanding how people are responding to food prices and how that's changing food insecurity. So there's lots of different hypotheses. And I'll just say this last thing. We share our data with, well, I'll say almost anybody except the food industry. And so as I'm talking today, we have lots of people that are outside of our team. We have a wonderful team across the world, but we have lots of people that say, hey, could I write up this paper? And if nobody has already writing that, we say, sure, give us a proposal and things like that. So if someone is interested in some of the data that I'm talking about, if you want to compare it to Brazil or something like that, feel free to reach out because we do try and share the data as much as we can.
Great, thank you so much, Dave. there's a lot of thoughts about what you're saying, and I would like to connect with two things that you said, and also connect with a question in the chat. So the question is, if we have time, Dr. Hammond, could you discuss the evidence that could be generated regarding dietary guidelines? And adding to this, you commented that I found it very interesting that policies to improve the information to population can help to increase the support for other kind of policies. And I think for the guidelines, it would be the same. So if you could comment if there's questions about support to guidelines and knowledge about guidelines.
Well, first, let me say that Canada brought in a new dietary recommendations. We call it food guide. We brought in a new food guide in 2019, right before the pandemic. And guess what? We stole all of our ideas from Brazil. And Canada used to have a food guide that said 5 servings of fruit and vegetables, 3 servings of dairy. It was all about servings per day. Those are all gone. And so now it talks about more patterns of eating. And it says some things that were very controversial. It says, don't drink juice. You should drink water or milk. It says, be careful of food marketing. Cook at home, don't eat out as much. And it said things like, take time to eat with others and enjoy your food. We stole them all from Brazil, but it was a big change. And Health Canada is being interested in how do we evaluate it. In Canada, most school kids, I have 3 kids, my kids have all learned about the food guide in school. But so we ask questions like, oh, have you heard about it? What do you know about it? Do you use it? One of the things we've done, it's hard to get objective measures though, because it's like 90% of kids say, oh yeah, I've heard of it. You know, I know it. I use it a bit. One of the things we did is we made, I think it was 8 different questions that are kind of true-false questions that are actually objective knowledge. And some of them are easy, some of them are harder. Like one example would be, all fats are unhealthy versus some types of fats can be healthy. Now, the correct answer is the second one. That's one of the messages in the food guide. So we went through the food guide and said, okay, here's 7 or 8 things. Now, instead of just saying, do you agree with the following? And everyone says yes. We tried to make it like objective, like true, false. What's another one? Fruit juice can be healthy, and then versus you should try and limit fruit juice or something like that. I can't remember. And it's very interesting because actually kids had the same or even higher levels of knowledge than adults did. You know, these are 10 to 17-year-olds. And it's because I think they're taught about the food guide in school. But it gives us a better scale, a metric to see these changes over time. The other thing we do is we try and assess whether people can identify highly processed foods. This goes back to NOVA and some of the work that Camilla's done. And so we're trying to get objective measures that go beyond, do you like the food guide? Do you try and use the food guide? But, you know, it's not easy, and some of these things take many years to change attitudes for things like 100% fruit juice, etc.
Great, thank you so much, Dave. Do we have more questions in the room?
Can you hear me?
No, the hand is up.
But can you hear me?
Yes.
Yep.
I have a question to Eury, actually. Thank you very much, because you responded very well our questions. And Eury, we want to know how NutriNet can help to improve public policies in Brazil. I mean, how is the impact of NutriNet to Brazilian health?
So I couldn't hear you very well. So how can NutriNet Brazil drive public policies in Brazil? Is that your question? Yeah. Yeah. As I tried to explain in my presentation, I think any epidemiological study can help guide public policies if it's well conducted, right? I think in NutriNet Brazil, the big advantage is that because it's web-based, you have a lot of flexibility to run new studies and test hypotheses. And for example, any study, for example, these studies that were carried out assessing whether there was weight change during the pandemic. This could have been used by the government maybe to implement public policies. So I think all of them can actually guide public policies. You can, for example, now that front of package labeling is being implemented in the country, yeah, maybe studies can be devised to try to understand whether these front of package labels are successful or not, if people are understanding them correctly. Yeah, I think data can be used to monitor changes in dietary patterns over time, or assess the association between dietary patterns and different health outcomes over time. Yeah, assess the association between dietary patterns and risk of developing different, yeah, the risk of developing different health outcomes. Did I answer your question, or did you want something more specific? Yes.
It was exactly like what I want, because when we think about cohort studies, we only think about the disease in the end, and I think NutriNet will be used to do other types of research, and it was exactly what I want to know. Thank you.
Yeah, I think that's why, because NutriNet France has been in the field for, I think, over 10 years, right? I think it's a good example, and it's such a similar study. And I think, as you said, I'm usually more focused on looking on the studies between diet exposure and outcomes. But there I saw that they've carried out other studies to actually, yeah, that have more direct implication on health policies, just, for example, testing or assessing how successful front of label packaging is. So yes, I agree with you.
Yeah, at this point that you comment that the flexibility is very interesting, because NutriNet Brasil has a basis of 100,000 participants and respondents that are connected and responding questionnaires through simple assessing through their cell phones or a computer. And it's interesting to see how NutriNet France, NutriNet Santé France has using this their basis of respondents to run different kind of studies, and not only longitudinal, also cross-sectional. So this is very interesting how this environment that was constructed can be used for different kind of study depending on the interest, and in a fast way. So it's very, very interesting. You want to comment?
Yeah, I agree with you, because in fact, this was my first experience with the web-based studies, and I can see how the team works and that flexibility. You know, you can re-question things, you can think how you can improve the measurement of certain exposure, certain outcomes, and you have that flexibility. I don't know if, for example, non-web-based studies, this is so easily done, you know?
Maybe I'll just add, you know, I always think that different methods have different strengths and limitations. And the type of study that you can do in terms of the flexibility of doing national surveys across regions, that is what online survey completion is ideal for, showing images, that sort of thing. Of course, there are other designs that are better suited for getting more robust estimates of energy intake or something like that. And so I think about these things are complementary, and it's about thinking about how, like we often do many different, I do some randomized trials. It's about fitting the methods to the purpose. It's just that unfortunately in many countries, and I don't know why, we have very good monitoring for things like tobacco use and things like that. And for for dietary intake and nutrition policies, many countries, it's just not there. And so this is where, you know, the NutriNet study in Brazil and some of what we do, I think really helps to fill a gap.
Yeah, we don't have any other question in the chat, but I would like to add a question about this flexibility. and everything, because it's flexibility, but there's also a limit on what we can add to the service, because we don't want to make people, we want people to complete the questionnaires and give us reliable responses. So I would like you both to comment about what is the issues to ensure that people are completing properly the questionnaires, considering that now people's attention has been like each time, the time that we can stay paying attention in something is reducing, especially in young people. So I think it's a challenge that will start to be more a big challenge maybe in the next years. So if you can comment. I don't know if my question was clear, but I can rephrase if needed.
Do you mean some of the methodological things to ensure data quality?
Yeah, to ensure data quality, considering that time that people spend paying attention and reading and questions, it's reducing over time.
Well, that's a good question. I mean, I can tell you some of what we do. So we have, we look at the survey completion time, and we have minimum standards that tells you how quickly they go through it. We have a very simple question. Some of you might know that in some surveys, they'll say some weird thing like, please pick option C. And they do that to make sure that people are attending it. But what we do is we have a question for our adults that says, please tell us what the current month is. Now we do that because it makes sense. It's not weird to ask. You only have a 1 out of 12 chance of getting it correct. And it also means that there's some minimum, in English we say cognitive, you have to be not smart enough, but you have to be aware enough to know what month it is. And we think that it could be a language. A lot of people that are rushing think we're asking what month they were born in, because that's a common question to ask. And do you know that we delete almost 5% of all of our respondents because they fail that question? And so it's a very simple thing to ask, but it's a good way of getting rid of bad responses. The other thing that is very good to do these days is to go through open-ended responses. So if you do surveys, now this is probably not a problem for NutriNet because you don't pay people, but anyone who gets paid to do a survey, they have bots. People will somehow find your survey and they'll get computers to answer it. And they are smart. They pick up some words and then they spit out an open-ended thing. But if you ask clever open-ended questions, you can tell whether people are engaging or not. And so it's actually, people used to tell us, don't use open-ended, they're horrible to analyze, especially in big studies, but they're important for data quality if you can ask 2 or 3 open-ended questions over a long survey. We have like things, consistent reporting. There'll be certain outcomes that are outside, like height and weight and other values where you can have objective limits. So we do a lot of that, and it does matter. We do exclude a fair number of folks, but that's important for data quality. So those are some of the things that we do.
Yeah, thank you for sharing all those strategies you use. It's certainly very, very interesting. I mean, I hadn't thought about the idea of looking at the time people devote to answer the question. What you talked about, the open answer questions, which, yeah, I always thought it would be better to avoid, but I guess they do have their positive side. Yeah, I think in the case of NutriNet Brazil, I think there was always a lot of caution trying to make questions short and questionnaires, short questionnaires. So I think that may help in terms of engaging people and helping people concentrate during the time they're completing the questionnaire. But I agree it would be good to, to find ways to check that, the reliance of the responses.
Yes, thank you, Yuri. Thank you, David, for your responses. I think we are almost in our time. Do we have more questions in the room? No? So I think we can go to the end of the webinar. I have just one more question for Dave that I've been here for 1 year, but I'm always wondering about this. Can we do longitudinal analysis with IFPS data? Is there people that are repeated in all the years?
That's a great question, and that's we could do that. You have more turnover. Did I hear you have about 80%, like from wave to wave? That's great. We do ours at 1 year apart. You typically only see about 30% retention for over 1 year for these commercial panels. Now we could try and do that, but we don't. So it is certainly a possibility, and we have done that in other studies with a similar methodology. So it's possible. But we've just chosen to go repeat cross-sectional because for some of our questions, we want a better like sort of prevalence estimate. Some studies do both. They retain people as far as they can, and then they replenish the people that fall out. So there are different methods, and I really think it depends on what your analytical questions are. But so you couldn't do those analyses with our current sample, but we could request to change the sampling so that we do follow people up over time.
Great, thank you. So
can I interrupt just before you say goodbye? I just wanted to say thanks again. It's been wonderful having Camilla here. If there's other folks that want to come visit, let us know. Brazil and Canada have been good friends for a long time, and I've always enjoyed working with folks down there. So thanks for the opportunity to participate in this exchange. I've said to Camilla that the idea of having a webinar to sort of connect groups, I think is a wonderful idea. So thanks for the opportunity to do it, and it's been a pleasure.
Thank you so much, Dave. It's been amazing to be here. It's a great experience for me and great to have you. Thank you so much for accepting to be in this webinar and to connect with my group in Brazil. All the time that people ask me about Waterloo, I highly recommend because I really like the university and the city. It's also nice. So
well, we even got you on ice skates. So
yes, I learned how to skate, and he helped me. Eury, you would like to add some final comments?
No, I would just like to really thank you for inviting me to participate in this webinar. It was a pleasure to meet you, David. It was a very interesting presentation, and thanks for sharing all those results. Yeah, and I hope we can keep on working together.
Thank you so much, Eury. Thank you so much again, Dave. I would like also to thank you, the audience, for being in YouTube and in the room. I would like to thank you so much, Thais, for all your help since the first webinar. She is my co-organizer in Brazil, so she has been helping me since the first one. And also thank you, the University of Waterloo and the University of São Paulo for the support. And also my funding agency, of course, the São Paulo Research Foundation, that has been allowing me to be here and to do all my research PhD. So thank you so much, everyone. And important comment, the webinar will be available on YouTube for those that are not attending today, but not immediately because there are some process that need to be done in the School of Public Health, but it will be available in a few weeks, probably. So I think you can close, and thank you so much, everybody.
Bye-bye. Thank you.
Bye.